Hello friends, I am Dr. Samrat Jankar, Advanced Laparoscopic Colorectal GI Surgeon based at Symbiosis University Hospital, Lavale, Pune. Friends, today we are going to know about what is fistula in ano and how it is formed. Fistula is nothing but there is a tube which is connecting inside the anal canal and outside over the skin. That is kind of tube or that is kind of tunnel, and through that tunnel some fecal matter goes and it comes with recurrent pain, recurrent pus discharge. Why the fistula forms? Friends, in perianal region we are having 8 to 12 glands. These glands mean for secretion of mucus. The secreted mucus keep perianal region wet. As the perianal region is wet, for us, the passage of the stool, that's what the defecation we call. The passage of the stool will become easy and smooth, and without much difficulty we can pass the motion. That's the function of this gland. When that opening of the gland get clogged or blocked by fecal material, that leads to infection of that gland. That infected gland will go across the sphincter or perianal muscle, and that exactly leads to perianal abscess. When person get perianal abscess, that person will have severe pain, may be associated with some fever, may be associated with some generalized malaise, and also your WBC count may raise. In that scenario, either delaying of the treatment will burst the abscess and have opening outside with pus discharge, or you are having tremendous pain, you go to your surgeon take a nick over that perianal abscess and which will get drained. Eventually it leads to formation of fistulization. In that scenario, it will form the tunnel connecting inside the anal canal, tunnel having external opening over the perianal skin, and will have recurrent pus discharge. That's what the fistula forms. Why the fistula is called complex? Why the fistula is the topic we need to understand. Fistula is called complex, or fistula is a frustrating for both surgeon and patient because of the two main reasons. Because when you get the fistula travels through the sphincter, and the sphincter, external sphincter, mainly deep part of the external sphincter, are known for your continence. Continence is nothing but you are sitting in social gatherings or in your workplace, you will get that urge to defecate. In that scenario, you can control your motion, and whenever there is a socially acceptable place you get, then you will allow your motion to pass. That's what happens normally in every person. That is called continence. But as this deeper part of the sphincter is controlling your continence, if fistula tract goes through and surgeon inadvertently divide that external sphincter, you may lose your continence. That's what leads to incontinent bowel. And other problem for the fistula is when surgeon under fear that this patient is having deep tract, this patient is having this problem, in that he will do inadequate surgery. There is also second problem comes, the recurrence. So fairly in fistula there are two important problems which are known. One is called incontinence, second is called recurrence. And for the surgeon and for the patient, what exactly needed is successful fistula means removal of whole the infection, getting cured without incontinence. That's what we are going to see in subsequent videos. Thank you.